Welcome, attendees and delegates, to this World Health Organization, SAHPRA implementation of National Action Plan for Fighting Standards, Substandard and Falsified Medical Products webinar. We will be starting shortly. We are still admitting other attendees. We should start at exactly 13:05. Thank you. Time is exactly 13:05. Ladies and gentlemen, welcome again to this World Health Organization in South Africa implementation of National Action Plan for the fight against substandards and falsified medical products webinar meeting. Ladies and gentlemen, substandard and falsified medical products are a global challenge, with the burden of these products more pronounced on the African continent. Their presence has both public health and socio-economic effects on populations. It is thus important that countries implement action plans to eradicate this. This multi-stakeholder meeting and webinar aims to initiate such an effort for South Africa under the support of the World Health Organization. Ladies and gentlemen, welcome. I will now take you through housekeeping rules as to how we will conduct this webinar. And those housekeeping rules, ladies and gentlemen, are that all your mics will be muted throughout the presentations. There will be a Q&A session. However, we encourage you that before this Q&A session, you may, in the Q&A platform that is provided in your meeting platform, pose your questions. Some of those will be answered right within the Q&A sessions section. Others will be answered during the Q&A session posed to the presentations. Ladies and gentlemen, without further ado, I would love to welcome Mr. Dion Puvan, who is the Chief Regulatory Officer for SAHPRA in an acting capacity, and to provide opening remarks and to welcome you to this webinar. Mr. Puvan, the floor is yours.
Thank you very much. Good afternoon, esteemed colleagues and partners. On behalf of the CEO of SAHPRA, it's my pleasure to welcome you all to this pivotal webinar hosted by SAHPRA in collaboration with the World Health Organization. Today marks the beginning of an important journey as we introduce the pilot phase of the National Action Plan for Fighting Substandard and Falsified Medical Products. During SAHPRA's attainment of the WHO Maturity Level 3 for vaccine production, significant strides were made in improving its market surveillance and control processes to prevent, detect, and respond to SF medicines, which will now be further improved through the implementation of a National Action Plan for SF medicines. As the South African regulator for medical products, SAHPRA takes the issue of substandard and falsified medical products seriously, demonstrated through South Africa chairing the working group for governance under the WHO member state mechanism for SF medicines and actively participating in other various working groups under this mechanism. The issue of SF medical products is a significant public health concern. This not only undermines the health of our populations, but also threatens the achievement of Sustainable Development Goal 3, which aims for universal health care access for all. The fight against SF medical products requires a united and collaborative approach, and this webinar is a testament to our commitment to this cause. Our agenda today is to introduce the pilot project, outline its objectives, and emphasize the critical role each of you play in its success. The pilot, which begins this year and will span 12 months, is designed to test and refine the WHO handbook on the implementation of national action plans for SF medicines. This handbook will later be rolled out to all other member states, providing a robust framework for preventing, detecting, and responding to SF medical products. We are fortunate to have a diverse group of stakeholders with us today. Your presence here underscores the importance of this multi-sectoral approach to tackling this issue. The expected outcomes of this webinar are to sensitize all stakeholders on the National Action Plan and the pilot project, clarify the roles and responsibilities of each participant, and secure your buy-in and active participation. We aim to foster a collaborative environment where we can share insights, address challenges, and work together towards a common goal. As we embark on this journey, I encourage you all to engage actively, share your expertise, and contribute to the discussions. Your input is invaluable in ensuring the success of this pilot and the broader implementation of the National Action Plan. I'd like to thank you for your commitment and dedication to this critical initiative. Together, we can make significant strides in safeguarding the health of our populations and achieving our shared vision of universal healthcare access. Let's make this webinar a productive and impactful session. Welcome once again, and I look forward to our fruitful collaboration. Thank you very much.
Mr. Puvan, now I'd like to call Ms. Marion Schoenfeld, who will be speaking on behalf of the National Department of Health, which will be the implementing department on behalf of the South African government. Ms. Schoenfeld, the floor is yours, ma'am.
Good afternoon, everybody. On behalf of the National Department of Health, I would like to welcome all attendees and presenters to this very important webinar. I anticipate that there will be fruitful discussions on this very important topic related to the safety, efficacy, and quality of medical products used in South Africa. A special welcome and appreciation to Mr. Kuwana from the WHO that will lead this National Action Plan pilot project within South Africa. The National Action Plan pilot project will be conducted in South Africa and aim to prevent, detect, and respond to the ongoing threats of substandard and falsified products within our country. The success of this National Action Plan project will depend on various stakeholders from different departments, partners, non-governmental organizations, and health facilities that are located both in the private and public health sectors. Therefore, these stakeholders have been nominated through your various organizations to join a steering committee that will oversee the National Action Plan project. This steering committee, once established, will also set up technical working groups consisting of relevant stakeholders. To ensure the success of this 12-month project, the National Department of Health requests collaboration from all relevant stakeholders. We look forward to the results of the National Action Plan pilot project and anticipate that the pilot will result in a useful tool that can be used by other member states to prevent, detect, and respond to substandards and falsified medical products within their countries. Thank you for your time.
Thank you, Ms. Schoenfeld. Ladies and gentlemen, we will now move to the next speaker. It will be Dr. Francis Magombo, who represents the World Health Organization locally. He will also be joined by Mr. Rutendo Kuana following his presentation.
Dr. Magombo, we can't hear you. Please unmute.
Chair, just give me a moment. I'm going to speak to him just now. He seems to be speaking. Just give me a few seconds.
Thank you.
Yeah, I think it's okay, but yeah, I can't see by. Okay, sorry, we had a bit of a problem, but I can just quickly go ahead with the presentation. So basically, I think my presentation was on the National Action Plan for the prevention, detection.
Dr. Magombo?
Yes.
You are sharing the meeting screen. Can you share your presentation instead? Just press stop share and share again, but go for your presentation. Thank you.
Marimeja, I'm going to share Dr. Magombo's presentation for him.
Yes, you may. So,
Okay.
Dr. Magombo, you may continue. The office will share on your behalf, and then you may proceed. Yes.
Okay.
Thank you.
Thank you. Sorry about that. Yeah, so that's the outline of my presentation. Yeah, so first, I just wanted to give a few remarks on the rationale for the national action plans. So in 2017, WHO estimated that 1 in 10 medicines in low and middle income countries was substandard or falsified. So basically that caused an expenditure of around 30 billion on these substandard and falsified medicine annually. So basically, these estimates were on a number of published studies from over 80 countries and 48,000 tested samples during a 10-year period. So just to emphasize that even in South Africa, we have this problem, as you can see on this on the second slide, basically, where there's a report from the SAHPRA to say that there were counterfeit glucagon-like peptide products that were circulating through online markets. So basically, this is just one of the examples to show that this problem does exist in the country. Now, going on to the other slide, I think we can skip that one on the NAP objectives, as they will be covered in the next slide. But going to the root causes, so basically the root causes are usually a combination of constrained access, poor governance, and also weak technical capacity that create a fatal environment for the emergence of these substandard and falsified medical products. Again, despite that, there are many strategies to prevent, detect, and respond to this. Many countries, there still exists a problem, basically a problem of lack of awareness, political commitment, and also limited investment because of low resources, and also lack of stakeholder collaboration and partnership. So these are some of the root causes of these sort of problems. Now, the National Action Plan basically aims to equip South Africa with fundamental tools to eradicate the substandard and falsified medical products, and also to ensure that medical products entering the national supply chain are of quality, and also they are safe, efficacious, and also basically perform as intended. The National Action Plan process will include multiple stakeholders. So engagement of these stakeholders will be important and will be essential for the forging of a response and recommendation of mechanism for governance and coordination. The National Action Plan encapsulates the strategic objectives, goals, with actions, inputs, and outputs and outcomes used for developing strategic and operational plans, and provides insights into the approaches for operational planning, monitoring, and evaluation. So those were my few words. Thank you so much, but only to emphasize on also need for political commitment, resources, and also coordinated approach for this to move forward. Thank you so much.
Thank you, Dr. Magombo. Kwana, you are.
Thank you. Thank you very much. I hope you can see my slides. Can I continue?
Please continue, sir.
Thank you very much. My name is introduced is Rutendo Kwana. I'm working with the World Organization based in Geneva at the headquarters. I'm very happy to be here at the invitation of SAHPRA and the government of South Africa in this collaborative effort. My task is simply to provide a little more detail on what we're looking into as WHO in support of South Africa and what we are hoping that your national action plan would look like. Firstly, maybe to talk about the statistics that Francis was talking about earlier, where he was talking about for example, 1 in 10 of the medicines that you find in more middle-income countries are considered to be substandard or falsified. And the other thing also to note is it also has several impacts, including high deaths for children, for malaria and pneumonia. And in our study that we published in 2017, we actually demonstrated that about 286,000 deaths in low to middle income countries, particularly in Africa, are attributed to substandard and falsified medical products. Also, you will notice that there are 3 main areas where we're looking at the impact of substandard and falsified medical products. You will excuse me if I have to use SF as I proceed in my presentation. There are socio-economic impacts, there are health impacts, there are economic impacts. For example, when you're looking at economic impacts, there could be loss because you have to buy alternative medicines. You have to waste resources, for example, going back to the clinic, getting more medication, seeing the healthcare practitioner. And also there's also increased out-of-pocket spending because you have to buy the medicines more and more. I would like also to maybe talk about recent events that happened. Some of you might be familiar with them, especially in the past 2 years. I'm sure some of you have heard about the situation that happened in the Gambia between August and October 2022, where we had unfortunate deaths of about 70 children or more because there was some contaminated cough mixtures and paracetamol preparations or liquid formulations. We also had immediately after more than 200 deaths in Indonesia, followed by Uzbekistan by the end of 2022. And these were caused by contamination of these medicines by an antifreeze, either diethylene glycol or ethylene glycol. And it did not end there, and it's still ongoing. April 2023, for example, we had reports coming in from the Marshall Islands and Micronesia, Cameroon, where we had at least 12 deaths, and Iraq also at the June, July, August to August 2023. So what you will notice is that this has been ongoing. This is a 100-year problem. It still haunts us. I'm sure some of you might have been following some events that occurred in South Africa also, where there were suspicions of products that were contaminated. At the end of the day, what is important for us to realize is that victims of substandard and sometimes falsified medical products actually have faces and names. And these are, for example, some of the victims that we found in the countries, Indonesia at the end, Revan there, Nadira also from Indonesia, and also the young man Musa, who died at 20 months in the Gambia. So just not being statistics, we're actually talking about human beings. We're also talking about lives. But going back to what Dr. Magombo was talking about, what are the major drivers? What are the major drivers for a high prevalence of substandard and falsified medical products in the various markets? And I'm sure also there is probably some of it applies to South Africa. We have issues with access. When people cannot afford medicines, they will try and look for alternative, cheaper sources. So what that means is they are liable to being provided medicines whose quality, safety, and effectiveness cannot be assured. In other instances, acceptability. When people accept second-grade materials, again, that's a driver. That's one of the reasons why you would end up having substandard and falsified medical products. Other things we could talk about is poor governance, either the procurement system, inefficient administrative structures, also weak technical capacity, as mentioned by Dr. Francis earlier on, where there are limited resources to actually detect the products, or maybe there's poor oversight. So what do we do? What can we do? We have several objectives, and as WHO, we have put everything into three main pillars: prevention, detection, and response. And under each of those three main pillars, we've got various actions, and our promotion for South Africa is to implement all these prevention, detection, and response strategies, and also those actions as much as possible. In other words, prevent SF medical products by getting the population to demand for quality products, also making sure that the supply chain is secure, also making sure that the detection processes in the countries are up to speed, and also whenever the products are detected, to make sure that the authorities or people in power or who have responsibilities can actually respond with the endeavor to protect public health and prevent recurrence of the substandard and falsified medical products. So what are the determinants? What is it that we need for us to be successful as a country? So they are overarching and they are interlinked. First thing is we need political leadership, political support. We also need to make sure that we have stakeholders that are in partnership with each other. And of course, it does not come cheap. We have to invest human resources. We have to invest our expertise. We also have to invest financially to make sure that it happens. So as WHO, we have developed a handbook, which we are promoting, and we're grateful that South Africa has offered to be the first country to pilot the implementation of this handbook. South Africa is leading one of the member state mechanisms in WHO on substandard and falsified medical products, specifically dealing with national action plans. So the experiences from South Africa will be very important globally for us to be able to inform future national action plans. So when you look at the goals of the national action plan, the primary goal is to apply cohesive and coordinated efforts to prevent, detect, and respond to the threat of substandard and falsified medical products. So we aim to improve understanding and awareness, whether it's public, politicians, people in power, people that can do something about it. We're also looking at strengthening the evidence base. You know, I was showing earlier that 1 in 10 medicines in low to middle income countries are considered to be either substandard or falsified. But what is the percentage for South Africa? And what is the prevalence? What is the burden on South Africa on substandard and falsified medical products? So little information is available. So we are also hoping that through surveillance and improved reporting mechanism, through the national action planning implementation, this is something that we can work on. We're also looking at increased information sharing between the national stakeholders, regional and global platforms. It could be the media, it could be the police, it could be customs, it could be SAHPRA. So we have different stakeholders that can contribute something, so that it's not just rumors, but information which is shared and the information can be acted on. Again, we can also optimize use of analytical insights, especially academia, for example, can come in and support in the implementation of the national action plans. And of course, we need to make sure that all the key stakeholders are engaged and coordinated. And this is why SAHPRA and the Department of Health have been mandated by the government of South Africa to be the lead agency so that they can support the implementation of the national action plan. So the process for us is that it has to be consultative. It has to have aspects of continuous improvement and learning, and it must begin at the start. It must begin with analysis of what we know, what we don't know, and what we need to know, and where we need to go, and how do we get there. So we need to define the goals, the strategic objectives according to risk. Everything has to be risk assessment, risk implementation, risk communication. And then right now where we are is we've just gone through a process of mapping the key stakeholder groups, and we hope your contribution will be very useful going forward. We will also need to look at establishment of a governance and coordination mechanisms amongst the stakeholders under the coordination of the implementing agency, which is SAHPRA. Would also like to look at activities that should be prioritized, again, in a consultative process. And once that is done, we need to make sure that we monitor and evaluate progress of the National Action Plan. Strategic objectives, again, focusing on the three main pillars of prevention, detection, and response. As I said earlier on, we need under prevention to demand for assured quality, safe, and effective medical products. We need to make sure that the supply chain is secure. When we're looking at response, we need to make sure that we protect public health, the public from SF medical products, and make sure that it does not happen again. But it must be sustainable, and that's one of the important things that we need to look at, how the National Action Plan, when we start implementing that, it is sustainable. So what are the determinants of success or sustainability? We're making sure that the population is informed, because an informed population will make the correct decision, will determine what role they can play in preventing, detecting, and response to substandard and falsified medical products. We need to make sure that not only today, but going forward, that you as stakeholders are engaged and we collaborate with you. We also make sure that we have effective risk-based activities that each of the stakeholders can contribute to the National Action Plan. I'm not sure whether everybody is clear, but the question really is, why are you here? Why did SAHPRA, why did the ministry, why did WHO invite you to this meeting? It's simply because you're a key stakeholder. Your role is, we are looking at different things that we, in our mapping of the stakeholders, you could be a user of a medicine, you could be customs and border control, you could be somebody who works in law enforcement, you could be press and social media, influencers are also not to be forgotten. So our next action when we have, after this meeting, for example, is to go back and say, okay, of all the stakeholders, who is responsible to perform certain tasks? Who should we hold ultimately accountable to completion of certain activities that are in the National Action Plan? Who should be consulted? So that we get their opinions. It could be subject matter experts, it could be users of the products, it could be anybody who has any role to play in the supply chain, and of course, who has to be informed about the implementation of the National Action Plan, the continued risk or not of substandard and falsified medical products in South Africa. One of the important things that was mentioned is the need for a governance and coordination structures. And I'm sure my colleagues from SAHPRA will be coming back to this in terms of how we look at the future of the governance and coordination structures. However, I just wanted to mention that what is important, what we look forward to as WHO is that, again, there is high-level political sponsorship. More than one ministry, not just the Ministry of Health, but more than one ministry has a role to play in the National Action Plan. We need to make sure that the coordination mechanisms are clear. Where does industry come in? Where does press, where does media come in? Where does the civil society come in? We also make sure that it is sufficiently resourced in terms of human capacity and financial resources so that we can implement it. Also, we need to make sure that we have regular and documented meetings so that everybody is kept up to speed on what is happening. So those are the things that we are looking at. So at the end of the day, what we are really looking at is that the National Action Plan is your National Action Plan by South Africa, for South Africa, by South Africans, and going forward, really with the buy-in of the South African community, the South African stakeholders. So it's a combined effort. and it has to involve genuine open partnership between all stakeholders to make sure that we combat safe medical products in South Africa. So in short, that's the perspective from WHO. I would like to acknowledge my colleagues from the WHO team here in Geneva, the colleagues who are working with Francis in the country office, and SAHPRA for, once again, agreeing to be the pilot country where we're implementing the WHO National Action Plan Handbook. Thank you very much, and I remain available for questions going forward.
Thank you, Mr. Kwana.
Program Director, is it me or are you?
My Major, we can't hear you. The next speaker will be Daphne Fafudi. She's the Manager Regulatory Compliance from SAHPRA. Daphne, you want to take the floor?
Thank you very much, Program Director, and good afternoon to the attendees of this very important webinar. And we really appreciate your presence in this webinar because you are our very important stakeholder. And the attendance is really, really appreciated because we can see that the number is big. And thank you for honoring this very important responsibility for South Africa. And it couldn't have come at a better time because you would know that currently in South Africa, we are seeing the scourge of these substances increases. So, ladies and gentlemen, I will just share about our journey towards developing and actioning the South African National Action Plan on fighting substandards and falsified medical products. And then I will keep on sort of like mentioning the fakes, unauthorized, unapproved, those that are of poor quality, they all fall within this. This is what we are fighting as a country. And also I want again to thank the WHO and the various stakeholders that are on this platform in ensuring that this is going to be a success for us together with the National Department of Health. So now, as you would know that we are the regulatory authority in South Africa as SAHPRA. The regulatory authorities are responsible for ensuring quality, safety, and efficacy of medical products that are in the market and to fight the substandard and falsified medical product. And in order for us to fight this wicked problem, we need to cooperate and collaborate with all key stakeholders. And I am so glad that you heeded the call, because on this platform, we've got academia, we've got industry, supply chain products, medical medicines, medical devices, and allied health products. We also have the Central Drug Authority, we've got civil society representation, we've got media, we've got, like, the list is endless. We've got health professionals, representatives, professional associations. We have got our partners we like your UNODC, your Interpol, your government departments that are key, your customs, and the freight forwarders. So the list is endless. All the relevant stakeholders are on this platform, their representatives. And not also to forget the faith-based organizations and the traditional leaders, representatives, and the relevant departments. So, ladies and gentlemen, we know that global health crises and also wars, in terms of the UNODCs, these exploits, they heightened the demand for exploitation of medicines and medical devices for falsification and also for substandardization. So we know as well that what kind of products are mostly affected. That's the products that are affected, and we remember what WHO emphasized about access. And mostly in terms of our findings, locally at home, regionally in Africa, and also globally, we have found that it's lifestyle and life-saving medications. In terms of lifestyle, I always like to start by saying that this is not coming from me, it's coming from one professor who said, people want to be hot, people want to be happy, and people want to be high. And if people want that, they would go out of their way to get whatever that makes them that. So in terms of hot, the example that was given by Dr. Magombo, you would know that we have a GLP-1 agonists, which are becoming a challenge at the moment. An example being that of products purporting to be Ozempic. And as we know that for off-label use, such product may be used for weight loss, which they are not registered for. But people, when there is unavailability sometimes of products, they will, that's where the organized crime as well take advantage of such, and then there will be products which are not evaluated by the regulator, which will see themselves in the market. And we are gathered here to fight such products. And we know that these kind of organizations are sophisticated, and they do have means to have these products available in the markets, and they make them available globally, such that even when you are fighting, you have got limited resources to do this. And as such, we are saying that collaboration of stakeholders is very, very important. So, and in terms of the high, we know that your narcotics and psychotropic substances, products that make people they have dependency and addiction are also on the rise and are being sold in the illicit channels. In terms of the happy, we see a lot of sexual enhancement products that are becoming available. Even like in South Africa now, we have a situation with the spaza shops, and these are some of the products that are made illegally available through those channels. And these are not products that are registered. These are products that infiltrate the market through illicit channels, and they are being falsified. And supply chain vulnerabilities, there's always some there will always be those vulnerabilities within the supply chain that these criminals use to avail those products where they are not supposed to be. Because we know that in South Africa, we have got a stringent regulatory framework to ensure that those medicines that deserve to be in the market will be able to reach the patients through the legitimate channels. And now we even have a problem of transnational cross-border trafficking. We've got online market platforms which even deliver at the people's doorsteps. And we also know that technology innovations, they are advanced. And as we also, as still part of organized crime, this sophisticated crime even knows how to print. They've got printing techniques to make a product look exactly like a genuine product when actually it's a counterfeit or falsified. And these products have got high profit margins because they don't come through the legitimate channels. They circumvent every process that is meant to. And in terms of the National Action Plan, you are invited here. Every one of you is a key stakeholder. for this to be successful, we require that organized plan and implementation. So we all have a role to play to safeguard the public. It is not only the responsibility of the Department of Health and SAHPRA, but it is each and everyone's responsibility. And our excitement with the WHO piloting this in South Africa is that this will also help us to demonstrate, identify the gaps, and also attract the resources possible, because we're working with WHO. It will help us to attract the resources that are needed through acquiring sponsorship, and also working with you where you are able to assist us to fill those gaps in fighting these wicked problems. And it has been mentioned that we really need political commitment. And please, departments, we will be communicating, because this is at an interministerial level, private sector, public sector, we will be communicating. And for it to be successful within a year, we will have to identify those who are already playing the roles, those who are at an operational level and actively will be able to partake and make sure that this is implemented. In terms of the objectives, as WHO has mentioned, is to help the countries to develop their own action plan in preventing, detecting, and fighting substandard and falsified products. And also, this will also assist with guidance on how we need to leverage on the stakeholder relations and competencies from policymaking, procurers, distributors, practitioners, patients, and consumers. So, and also to promote good governance and collaboration amongst those with interest in this, and also provide regulatory oversight and participate in combating these substances. And finally, to support SAHPRA in achieving a stable, integrated, well-functioning regulatory system, particularly in specific aspects of market surveillance and control. And in terms of the response required for this national action plan, we need to improve understanding and awareness of substandard and falsified medical products at national, regional, and global level. So very important, you would have seen that we have already started some communication through our webinars and also through media, but we need you as our collaborators to do it together through a platform of the National Action Plan. We need to strengthen the evidence base through surveillance and improved reporting mechanism. We need to increase information sharing. We need to optimize the use of analytical insight to design and implement initiatives, and also engage and coordinate among stakeholders to strengthen and sustain systems that combat this. And where are we? So following identification of South Africa to be the pilot country, following that communication from WHO, the ministry supported SAHPRA to be the lead agency in South Africa, and we had some meetings with WHO in preparation for this, our local office, Afro region, and the headquarters. And we also did situational analysis to see where we are. And today we are holding the sensitization webinar with all the key stakeholders. So as I spoke about situational analysis in terms of the strengths, so we do, in terms of our presence at the borders, we do have an experienced and skilled workforce in South Africa. And we also, but as the key agency in ensuring the National Action Plan on fighting this, we have informal relations with enforcement agencies and a lot of you stakeholders on this platform. It would be very good to formalize those relations through the NAP. We have a strong regulatory framework which conforms to WHO maturity level 3. And we have a good relationship with international organizations and partners. And we also have South Africa, a well-established health infrastructure. We've got well-established policy structures and role. We've got well-established and equitable access to essential medicines and healthcare system. With regards to some of our weaknesses, this includes the lack of formal cooperation and collaboration in the form of MOUs with the stakeholders on this platform and or the key stakeholders for the NEP. We also would wish to have technical infrastructure for monitoring and reporting these. So, for example, to have detection tools at the ports to be able to, as we know, we import a lot, to be able to detect those at the points of entry. We also do not have strength in vigilance capacity and reach because of SAHPRA is it's centralized. We are currently having only 3 offices. We need regional and provincial and local presence, and also limited resources to implement and sustain this national action plan. And we know that with not only at health, the Ministry of Health, but other ministries as well, there is some slow bureaucratic processes. For example, with this being an interministerial project, we will need to be appointing the steering committee as DOH has presented. So as we will be appointing the steering committee, we need to make sure that this is expedited because we only have a year and the correct people are being appointed. And you on this platform, we are asking you to facilitate such when the letters are written to your ministries and departments and organizations, we are asking that facilitate that this goes faster so that we can, as soon within a few weeks, we can then have our steering committee meet to start the process. A lack of formalized strategy for communication on substandard and falsified medical products, the inability to assess the actual prevalence, because I mean, we have had recently in the news that you find medicines in the informal markets, which are not supposed to be there in the spacer shops. And we have heard about children dying after consuming some of the, and people also being hospitalized after consuming products that are coming from the informal market, some of which they were even showing that they even have medicines. And informal market surveillance capacity is a very serious weakness. And together with you, we would be able to put some systems in place. And lack of government oversight on private sector stock availability, poor post-market surveillance sampling and testing, capacity reach, and also not properly, our supply chain is mapped, but we can see recently that we need to expand. In terms of other opportunities, South Africa, political stability is one of our strengths. We have just, we've got a new administration and the transition went well. We've got existing relations with our international organizations and stakeholders, active and available availability of self-regulation by the supply chain stakeholders. For example, the Marketing Code Authority in South Africa and other associations, which are, although they are voluntary organizations, but we see these key stakeholders being part of such organizations because they know the value of having quality products on the market, genuine products that goes through a process of approval in the market and what compromising those does. We've got active media for public awareness. Our media is very active and we are also appreciating that. South Africa's geographical importance in the regional supply chain is our strength, and education and awareness to empower stakeholders for prevention, detection, and response. Although our relationships have been informal, but we have been able to work together. And it will be this is an opportunity for the MAP to formalize that and also ensure that successfully we will leave a national action plan that is solid at the end of the year of this project. Political buy-in is an opportunity, but we are asking you, our colleagues, again to say we would like you to help. We would like you to please help facilitate the implementation of this. Mapping of supply chain and yeah, so this is our opportunities as summarized. And then in terms of the threats, of course, unintended negative consequences that may result when you do awareness campaigns. You might actually be alerting some criminals on where you are, what you want to do, and we know how fast they are. And insufficient reporting systems and the effect of macro economy on ability of South Africa to resource this. And we also, as different stakeholders, we have divided priorities, but it would be very good if we can redirect, because this not only affect our generation, but it will affect the subsequent generations, and we would be blamed as to what did we do. So currently as SAHPRA, we don't have our own laboratory. We outsource these services, but the laboratories that we do, those are accredited labs in terms of the ISO and together with the WHO and pre-qualification. Okay, and in terms of online sales, we know how much challenging these are. And this is not only for local, but regionally and globally, this is a challenge. But together we can share strategies on how we can fight that. And slow legislative processes, and at the moment the slap on the wrist penalties. But together, if we can use our laws, like for example, the CPIC laws on counterfeit to complement the Medicines Act, those are some of the collaborations that we have seen beneficial to us. So in terms of improve understanding and awareness of substandard and falsified at national, regional, and global level, SAHPRA has an active engagement and representation, as it was indicated that in the WHO member state mechanism and the associated working group of the member state mechanism. We are chairing the governance group, and we also, in terms of the substandard and falsified medical products, we chair the SADC region, and we also are a member of the Executive Committee of WHO, substandard and falsified focal points in Africa. And South Africa is also a member of the Permanent Forum on International Pharmaceutical Crime. And also at SADC level, we also at the SADC level, we at local level, we have a pharmaceutical crime forum. We have a recall and rapid alert system that is functioning very well, but it can be improved. And we also have conducted a number of multi-country, multi-agency, multi-stakeholder webinars on these, and these were well received. I have spoken about this, and I also indicated the challenge of the regulator not having its own internal lab, which is something that we are working on. And also in terms of resources, currently with our post-market surveillance testing and sampling and testing throughout the supply chain, because you would know, as we said, that we are importing a lot, and we need to make sure that from distribution and throughout to these products from being imported and also being in the distribution warehouses, wholesale, together with being transported to their hospitals, their community pharmacies or relevant clinics. Before the patient gets those medicines, we need to make sure that the patient is still getting the same product that was manufactured in terms of stability, quality, and that the lifespan of that particular product will still retain its effectiveness. So what we do is that although we do post-importation testing, but we also, as a regulator, we enforce post-market surveillance, sampling and testing. But because of limited resources as well, we the samples that we are taking are not really a representation of the market. So we are hoping to expand this to ensure that we sample sufficiently at various points, and also it will represent what is in the market, and we will be able to say these are quality products. They still retain their quality and their effectiveness and safety. The advertisement of products online and the sale of online, I have mentioned that is a challenge, because now, you know, when you close the site, the others pop. So and also it requires strategies on how can we, because we also don't have capacity on detecting those as well. So we need to collaborate and work on prevention, detection, and response strategies. So with that, Chair, I just want to thank you very much for the opportunity to present. Thank you, everyone.
Thank you, Mehofudi.
We cannot hear you. Melanie, can you please assist?
No problem. Thank you so much, Daphne, for your presentation. Next on the program is Perspectives from Industry. We have Stavros Nicolaou, Group Senior Executive at Aspen Pharmacare. You can come through.
The Program Director and all the distinguished and esteemed colleagues and panelists, good afternoon. Assuming you're all on the same time zone as I am, which I think might be the case, it's a great pleasure for me to present an industry perspective, and also to make some supportive, complementary and supplementary comments to what has already been presented. I think, let me just say at the outset that I'm fully aligned with all the previous statements made. They've all been statements that emphasize the criticality and the importance of this initiative, albeit at a pilot stage. So what remains for me to do, so that I'm not too repetitive, I'd like to make 3 points. The first is that I speak here today in a dual capacity, firstly as Aspen Pharmacare, as the Program Director correctly pointed out, but I also double up as the Chairman of Pharmisa, which is Pharmaceuticals Manufactured in South Africa, and I'm also the Vice Chairman of PTG, which is the overall industry umbrella body. So I'm making these supportive comments wearing all 3 hats today, but particularly the second one, which is to provide a local industry perspective. So the 3 points I wish to cover is, firstly, that fake, substandard, suboptimal, counterfeit, contraband and illegal products are of immense concern to the domestic South African pharmaceutical industry. We have these concerns for a number of reasons, not least of which, and I really want to stress this point because not too many speakers have made the point as boldly as I intend to, that if we have a situation where there is a proliferation of SF products, then the integrity, trust, and reputation of the entire value chain will be compromised. And there is nothing worse. It's bad enough having suboptimal products, but what is even worse is if patients and healthcare providers out there are refusing to either prescribe and or take medication because they have concerns that the integrity of the system has been compromised. So part of this exercise, the initiative and the pilot, is also to restore confidence to the extent that it's been dented. And of course, the communications that flow singularly and jointly from the regulator, from the different key stakeholders and partners are equally important, so that we don't cause widespread anxiety and panic out there. And as I said, there will be nothing worse than if patients are reluctant to take life-saving medicines because they're not sure whether these are contaminated or compromised in any way. So I cannot underscore sufficiently that point. It's in nobody's interest that a value system is compromised in any way whatsoever. Industry, if I can move to my second point and try and unpack some of the concerns that industry has. Our concerns are mainly that compromised medicines in whatever form or shape, whether it's suboptimal or contaminated products or sub-quality products, whatever the case might be, are going to increase what we categorize as iatrogenic diseases. Now, there is already globally, not just in South Africa, there is already a rising tide of iatrogenic diseases, and this will only add to the situation. It will weaken healthcare systems. It will further stretch already overstretched healthcare budgets as you try and manage patients that should have been managed appropriately on safe medicines, starting to experience side effects, being hospitalized. So budgets will be stretched even further, and that will further lead to a deterioration of healthcare outcomes, which we can ill afford. The other concern that we have, of course, is that the impact is not only on a compromised public health, or from a public health perspective, but also lives, livelihoods, and economies will be affected. And at this time, particularly in our country here in South Africa, where we do have some fiscal management concerns, and we are trying to grow our economy, any dilution of that effort will not augur well for the economic growth trajectory that we're trying to realize in our country. When I talk about public health concerns, I obviously, of course, am referring to an increased burden on disease. And we should always bear in mind in South Africa that South Africa has around 9 million HIV-infected patients. That is by far the highest of any country in the world. Put differently, South Africa carries 16% of the global HIV infection rate. That's a disproportionate load that we carry in our country. And of course, these patients are all, or most of them, particularly those that are not well managed or taking their ARVs as they ought to be, present significant immunocompromised situations. And if you start adding to immunocompromised patients suboptimal medicines, then you are only going to deteriorate that situation. Patients that are controlled on ARVs will become resistant to these. It feeds into the whole antimicrobial resistance that is starting to present as a rising tide as well. So it has a virtuous race to the bottom effect if we do not arrest the SF products with immediacy. Now, let me move to the last point, which is, what do we think as industry are some of the immediate measures that can take place to prevent, or at very least mitigate the risk? I think the first thing is collaboration, cohesion, and coordination across all the key stakeholders in the entirety of the value chain is critical, and that's why we would like to commend SAHPRA and WHO, and we would like to congratulate them for hosting today's first session, and hopefully it won't be the first and last. I'm sure it won't be, but really important that you get all the role players facing in one direction, coordinated, so that you can give a cohesive response to what is becoming an increasingly concerning problem. The second thing is working together in a partnership will require resources. It will require expertise and capacity. And I think industry is open to understanding what these capacities and resources might look like, and to see it certainly won't be the first time that South African business works together with government on various initiatives. Of course, we've got to ensure that there's appropriate governance in place. Things are done at an arm's length, but I think we would be keen to find out and offline what these resources and capacity might look like, so that you can have a coherent and effective response. Now, the other area that is important is the strengthening of regulatory oversight. What do I mean by this exactly? Here I'm referencing both the enforceability of the law. There's probably no bigger deterrent than when the law enforcement agencies act, and that in itself sends out a message to all other perpetrators. So a decisive, well-resourced enforcement environment is critical. The other thing that I think is important from a SAHPRA perspective is that when there are products that are particularly prone to fakes, counterfeits, etc., that the registration of these products is accelerated. There's no better way, again, of mitigating counterfeits and fake products than if you have the legitimate product registered on the market. It does allow you better management and control, and I think there's got to be almost a separate categorization of those high-risk products, some of which have already been mentioned here today. For those high-risk products, accelerated registration, priority review becomes critical so that you can get the legitimate, authentic product into the market. Those who peddle counterfeits in the absence of an unregistered product will take advantage, and I cannot stress enough today the urgency to have these products registered, whether it's registered as an NCE or whether it's a Section 36 requirement that needs to come into play. These things need to be accelerated because they do provide a significant deterrent to those who are going to perpetrate. So in conclusion, colleagues, I've tried to give you a sense of industry's concerns. They are very similar to what everybody else expressed. We should never forget that if we have a denting of confidence in the integrity of the value chain, it has a domino effect which can spiral out of control. We should never forget that this is a public health burden, but also it impacts lives and livelihoods eventually, and economies. And then lastly, I want to reiterate industry support for this initiative and look forward to the next steps. And we will, of course, continue to be an active participant in executing on what is a plan that will mitigate this risk significantly. So thanks very much for the privilege of allowing me to present to you. Unfortunately, we'll have to dial off after the next 5 minutes, but hopefully you will take this contribution of industry as a positive and constructive one. Thanks very much. Back to you, Program Director.
Thank you, Mr. Nicolau. Thank you for even the support expressed by yourself on behalf of industry. Ladies and gentlemen, we'll stay with industry perspectives. I would like to invite to the floor Ms. Delphine Marshall, who is the Associate Vice President and Assistant General Counsel at Lilly's Regional Regulatory Legal Team. Ms. Marshall, the floor is yours.
Thank you very much, and thank you very much for the opportunity offered today by SAHPRA to present. So I will just share my screen with a couple of slides. Okay. Can you, sorry. Can you see my screen?
Yes, we can.
Yeah, okay, perfect. So I'm speaking today on behalf of pharmaceutical companies impacted by these issues involving substandard and falsified products. And the objective of this short session is really to show how substandard and falsified medicines affect the industry with concrete example of GLP-1 products. So I will highlight key points to be considered as part of this project. First, as a reminder, it is important to note that they are concerned about unsafe usage of the product, as these GLP-1 and or GIP GLP-1 medicine should not be used for cosmetic weight loss, but only for their registered indications. And these products are not recommended for individuals under 18. Importantly, we need to raise awareness of unlawful products, also as Stavros stressed before, because these fake products are being sold online and through social media. They mimic genuine medication, but these products are illegal, unapproved, and unsafe. And they are manufactured under unsafe manufacturing conditions. There are no GMP inspection conducted, no control from the authorities for these manufacturers. So we basically don't know what these products are, and the dosages can be incorrect and could present an overdose risk as well. Therefore, we strongly recommend that patients should purchase only from licensed pharmacies based on a prescription issued by a registered doctor after a medical examination to avoid fake, counterfeit, or unsafe products. What are the risks with substandard and falsified products? There are different categories of unlawful products. First, there are counterfeit products. These fake products are illegal and not inspected by regulatory authorities. There is no guarantee about their quality. This product may be manufactured in unsafe conditions, as I mentioned before, with sterility issues, and they could contain no active pharmaceutical ingredients, wrong medicine, incorrect dosages, or multiple medicine mixed together. So again, basically, we don't know what these products are. Second, compounding GLP-1 and GIP GLP-1 product is also a threat because they are not made, tested, or sold by registered and authorized pharmaceutical companies. These non-registered products are not approved by health authorities or either global regulators. And there is a potential serious health risk with this product because they may contain bacteria, impurities, or incorrect chemicals. Third, we want to warn about the unapproved formulation of GLP-1 and or GIP GLP-1 medicines available, unfortunately, on the market. It is important to note that these genuine products are only approved for subcutaneous injection, and the suspicious entities are offering untested oral versions, including nasal sprays and pills, with no verified information about the active substance contained in them. We don't know, again, what these products are. So, how to protect patients from misleading online sellers? As mentioned before, especially by Daphne, there is an increased risk with online sales on social media. It is important to notice that registered products are sold only through licensed pharmacies, and the registered products are not available for purchase on social media. So all products available on WhatsApp, Instagram, Facebook, or other are unlawful. There are also misleading posts, videos, and ads promoting research purpose only products. These products are not authorized to be sold. Healthcare professional supervision is necessary for these treatments. And we want to reiterate once again that social media is not a replacement for healthcare professionals. I also want to mention that there are global safety concerns about substandard and falsified products. And And authorities and regulators are showing willingness to handle this growing problem, as we can see today with this webinar, but also with other examples from other countries. For instance, the Australian government banned compounded GLP-1 medicines, and this is effective as of the 1st of October due to the risk for patients. US FDA has also warned of safety risks with compounded products. In Europe, the Industry Association, FPA, released a proactive statement on patient safety concern with counterfeit medicines and posted a LinkedIn message. In various countries around the globe, there are patient advocacy groups highlighting the danger of compounding medication. So, to reiterate a bit with what Stavros mentioned before, what can be done next to support and protect patients? First, we need to communicate and take legal actions. It is important for the industry to engage with regulators and the public. And thanks again for today's opportunity, which is a good example of this collaboration. We also need to raise awareness about compounded, counterfeit, and fake GLP-1 and GLP-1 products via different channels, for instance, media release or webinar. And finally, there is always a way to pursue legal actions against those falsely claiming their products are genuine ones. We also want to encourage regulatory actions and advocate for patient safety, encourage regulators to protect patients with fighting against substandard and falsified products, as the South African authority, together with WHO, are showing their willingness to proceed. And once again, to conclude on a positive note, we want to remind the success story in Australia, where the government banned compounded incretins to protect patients. This is a great example of a successful outcome against SNF products. Thank you very much for the opportunity.
Thank you, Ms. Marshall. We'll now be moving to the Q&A session and discussions. Ladies and gentlemen, we'll start with the questions that are posted in the Q&A. I'll ask Ms. Melanie Govindasamy to just check for us those that have not been answered yet and raise them.
Okay, Major. I'm going to go from the top. It's the latest, and then move down to the older ones.
That's all right.
Yeah, this is from Wilson Chandomba. I am from IAPHL as the regional leader for Southern Africa. In the challenge for SFs, we need to involve all players in the entire supply chain, including logistics, providers, transporters, port authorities, custom authorities, and their employees. This is the area which needs closer monitoring. As for example, a wholesaler is registered by NMRA, but other stakeholders are not. GSDP guidelines need to be comprehensively designed, documented, and correctly implemented in the end-to-end supply chain, as this will significantly reduce incidence of SS in the end. Okay, this is not a question, this is just a comment. This is a question from Leilani Johnson. Who do we report illegal sales to? SAHPRA, WHO, or the original product owner? I think it depends on the country that Leilani is situated. Daphne?
Okay, yeah, we will take it that they are. Yeah, so but from South Africa, we are saying please report through SAHPRA on our website. I can even, I'm just going to share my screen so that I can show how this can be reported. Can you see my screen?
Yes, Daphne.
Okay, so this is, do you see, is it showing the website?
Yes, it is.
Okay, so on the SAHPRA website, if you go to SAHPRA website, there is contact us there, and then you will see that there is whistleblowing or non-compliance reporting. You click there, and then you will either click complaint relating to medicine and medical device, or you can, if you want to remain anonymous, you can actually click on this one, where there is also a number. This is a company that is outsourced, where you can safely report and give all the details of what the problem is. It's a hotline free of charge. Then you can provide all that you need to report, and they will ensure that you are anonymous. And also, if there is any, if you want to also share information with your name on it, you are also even more welcome. So with regards to the SAHPRA, also you will remain anonymous. Want to, you just have to complete the details so that we will be able to investigate. But we really encourage reporting of those. Thank you.
Thanks, Daphne. This is from Simone Short. Are these multinationals protecting products versus locally manufactured generics regarding substandards? And is there an actual list of products? I'm not sure who this question would be directed to.
Okay,
should I
repeat that? Yeah.
Are multinationals protecting products versus locally manufactured generics regarding substandards? And is there an actual list of products?
Okay, so with this project, what we are intending to do is, if all the products that have not, remember, all the products must come through SAHPRA for evaluation, and then so that they can be in the market and enjoy sale. But now, if there are products that, so all of those that have been through registration or authorization, those are the products that I spoke about, post-market surveillance system that will be looking at. But parallel to that, we are saying, let us fight all the products that are not meeting the quality, safety, and efficacy standards, be them legally or illegally. We have to jointly prevent them from being in the market. So this joint responsibility requires us to collaborate and see how we can get rid of those in the market.
Thanks, Daphne. So this is also Simone Short. Dear Daphne, really good work. We'll be sharing the SAHPRA plan or a draft plan for comment or just a communication. Do you need stakeholders to participate in the plan development?
Thank you for that. So the invitees of this platform, you will receive, because remember, a steering committee can only have this number, but all the key stakeholders will sit on that steering committee. And then the steering committee will have working groups. There will be working groups, and the working groups will comprise of the experts in those fields on, and they will all look at prevention, detection, and response within those working groups. And that will, remember, at the end of the day, we have to develop a South African national action plan, which will, when WHO leaves here, it must leave us having implemented and hoping that we'll develop something that will be sustainable. So you will form part of that critical working, that critical structure. Thank you.
Thanks, Daphne. This is from Anastasia Naidu. She's not too clear on the practicalities of the SF tool rollout. She wants to know whether this tool will be available to industry to report SF cases.
Yes. Through the working groups, that will be available. But at the moment, through SAHPRA, you still report the normal way that we are saying, but we will communicate further developments if there is any other way.
Okay. Simone Schott again, she's been asking me a lot of questions. She's actually referring to the WHO handbook. She's placed two different links and I clicked on them. One was referring or dated as a 2017 document and another in 2022. But Daphne, are you intending to share this handbook, the latest version, to stakeholders?
I think maybe I'm being misunderstood. Rutendo, maybe you can come in and explain. But I think the people who are on this platform understand what we are saying. So Simone, I think you are not understanding that I'm saying that you're going to form part of this. A handbook, it speaks about the National Action Plan strategies, and it helps to give direction. So on how we can implement the fight against substandard and falsified medical products. So it is through the steering committee and the working groups that this work will be done. So the steering committee will have it, the working groups will have, I'm not sure if now you are answered. This is a year work, but you will be active part of through your representation.
No, I think she understands. Sorry, Daphne, I think she understands. I just think the current handbook that you have, your version, what she's referring to is their older versions that she's accessed online, which is a 2017 version and a 2022 version. So I think she's trying to understand whether.
From where? From where?
Where did she access it?
From which organization?
It's the WHO.
Could I intervene?
Sure.
Melanie?
Yes,
Yeah.
Rutendo.
So the WHO handbook, as mentioned by Daphne, is still a draft document, so it's not publicly available.
Okay.
So the link that the colleague accessed is a report from 2017. And also the other link is a report from the member state mechanism following one of its meetings. However, in the focus groups and working groups, when they start working and everybody has signed all the requirements in terms of confidentiality and so forth, which will be part of the process of developing the national action plans, the draft handbook will be made available. However, if at any time the document is approved by WHO processes before the end of the pilot, it will be released for public. Otherwise, it's not for public availability at the moment. Thank you.
Thanks, Rutendo. There are a lot of questions. Okay, there's one from Bada Parasi. Is SAHPRA intending to work closely with BMA, Border Management Authority? We all know how porous our borders are, and they are serious sources of illegal goods, including SF medicines.
Yes, Bada. And we are currently we are working on an MOU, which is at its final stage between the two organizations. But also this platform is going to make sure that that happen, which you are going to be your organization, or rather your sector will be represented to ensure that happens. Thank you.
Thanks, Daphne. This is a question from Wilson Chandomba. We have huge quantities of codeine containing cough syrups being illegally imported into Zimbabwe, such as Bronclear Benylin with codeine. What is SAHPRA doing about this challenge, especially in the area of supply chain traceability and chain of custody? The quantities are so huge, maybe there could be a factory somewhere manufacturing counterfeits of such products.
Okay, I think that we can take offline because it's not speaking about substandard and falsified, but it's we've got a codeine care initiative that we are working on such as well, and we will be able to address that through that as well. So we are out of time, Melanie.
Yeah, it is 2:35. Adimeja, you want to come through and maybe go on to the next item for closing remarks?
Thank you, Melanie. I think we have exhausted the program. So for the questions that have not been answered, they will be noted. And hopefully as we convene this meetings related to the NAP in future, we will address those questions. Ladies and gentlemen, I would love to call Ms. Daphne Fafudi to provide us closing remarks and also a way forward as to how we are going to then, what would be the next steps rather in the implementation of. Please come in.
Thank you, Program Director. And thank you very much to the stakeholders on the platform. And I appreciate that the numbers, we still have the numbers that have joined the webinar. We've lost a few, but not significant. Thank you so much for your attendance, and we realize that this is very welcome. And through the principals, we would be sharing appointment letters with the nominations to the representations of your sector. And we are asking that for this to be successful, it will be through your active participation. And please feel free, if you do not, you have not received anything through in terms of your sector, like for example, academia will be represented, non-government will be represented, government will be represented, media will be represented, pharmaceutical, medical devices. There will be different stakeholders that would be represented, and then we are hoping that before the end of the year, those letters would reach your principals, and with the date of the meeting, the first meeting envisaged, with the terms of reference of the steering committee and also of the working groups as well, shared with those letters. So, and we are very excited to see that there is a positive reaction to this, and that South Africa will produce a successful pilot for WHO. And as a result, because this, while we are doing this, we will be also attracting resources, and we hope that at the end, the National Action Plan will be a tangible, sustainable product that we can remember our relation with WHO with, and also have solid relation with all the key stakeholders. Thank you so much.
Thank you, colleagues, and thank you all. The webinar is now come to a close. Enjoy the rest of your day.